I was naturally drawn to the lungs. I also think it's one of the most terrifying things anyone can imagine is not being able to breathe. And so being able to assist patients and help their families with people who are having that difficulty, it's something I felt I was driven towards. I take a very patient-centered approach to all care. And what's nice about pulmonology is there is options for patients. The big one, symptom-wise, that I would say we treat is cough, shortness of breath, chest tightness. However, there's also incidental findings that come in. People have CT scans and nodules are found, so we follow up on that. There's definitely long COVID, and we're seeing a lot of COVID haulers, where people are coming in who previously had no lung trouble and now are experiencing significant shortness of breath, continuous coughing. The environment definitely plays a large role in pulmonary diseases. Inhalational injuries. I think the biggest one everyone really thinks about is asbestos inhalation and mesothelioma. When that ends up happening, you can inhale everything. The lungs themselves, they're not a sterile environment. You inhale it, it gets in there, and diseases take form. The question is, what type of disease are we dealing with? Is it an infection? Is it inflammation? Is it allergies? Patients go into distress in my rooms, and I have to know what to do next. A lot of my strength comes from understanding the unknown, the uncertainty. When I was 12 years old, my mother was diagnosed with breast cancer. It enables me to connect with my patients. I think that there's a definite need for providers to be advocating for their patients, whether that's to the insurance company, to the DME company, to the company who may be giving oxygen, and also reassurance, letting them know I'm here. One thing that I do say to my patients is that my goal for them, and my goal for me, is to keep them here as long as I can, in the best shape that I possibly can.